sessions to go through where we believe we are as a nation on health care. I'm obviously concerned that suddenly the Democrats, without really reaching out to us, have decided they want to mark up bills in both chambers by the August recess, and there's no bill available for anybody to look at. And I think that's truly because there's no bill available. I noticed President Obama's website last week, I had about half of the points on it had 3 weeks before that. And the 8 points that they've been talking about are now 3 points. And actually their 3 points are the same 3 points that we've been talking about for several weeks out of this group, a system that everyone has access to coverage in, a system that people can afford, and a system that focuses on quality. And that's apparently now where the administration is. So why you need to use special rules and special efforts to force a partisan decision on this topic when you really do have Republicans reaching out to all of the elected leaders. And I sent a letter yesterday to the president that said, you know, we continue to be here, we continue to reach out to you. We want this to be a bipartisan effort, but for it to be a bipartisan effort, you have to talk to us. And that's not happening. And so Jenny Brown-Waite from Ways and Means Committee is going to talk just a little bit about our principles, and then we'll go to whatever questions you all might have.
Last week we sent a letter to our colleagues setting forth the principles that this group has come forward with and asking also for their involvement. The first principle is to make quality health care coverage affordable and accessible for all Americans, regardless of pre-existing conditions. Second was to protect Americans from being forced into a new government-run health care plan. Most Americans like the plan that they have, first of all. We want to make sure that they are able to retain that choice. About 83% of Americans who have health care coverage right now are very satisfied with their health care coverage. So we want to make sure that what they have, if they like it, they can keep it. And we also want to make sure that these decisions are, health care decisions, remain with the patient and the physician, not a bureaucrat. Whether it's a senior in Florida needing a cardiologist or their children or grandchildren who may be having their first child, expanding their family, needing an OB/GYN. Government should not be the arbiter and the dictator of who provides that health care coverage. So we sent this letter out indicating that these are the principles that we've come forward with. I know that we're having some listening sessions for Republican members who didn't serve on this committee, and we want to make sure that we are involved. And as a matter of fact, and every member here knows it, and certainly the press knows it, the Blue Dogs also feel as if they need to be involved, and I'm sure that these are principles that the Blue Dogs would go along with.
What questions do you have?
Is there an effort to reach out to the Blue Dogs by Republicans, by you guys, to try and maybe form some sort of alliance there? Is that a possibility?
I think individually we've had a number of discussions with Blue Dogs. Some of our members have been particularly involved in that, and I think Jenny's right in a general agreement on the principles. In fact, at this moment, it looks like that our top line principles that the president is now focused in on his 3 top principles. But we want to reach out to the Blue Dogs. I've met with the majority leader. My staff's met with his staff. The leader's staff on health care has met with his staff. I mean, clearly we've been reaching out. The meetings that the administration's having right now don't involve us, but we'd like for them to. And I suspect that Democrats who agree with us would like to be involved in those meetings as well.
I think Congressman, I'm sorry, since you rely on principles that you put in place, where and what the president has proposed or what's coming up in hearings the Democrats have made, they said that they're going to give bureaucrats the power to determine what doctors can do with their patients. Where does it say that? What are you responding to when you bring that up?
It's very interesting because we often hear that they want the American public to have the same health care program that Congress has. Well, there's no public plan in what Congress has. We have a menu of health care options that are available, and there is no, quote, public plan. And what will happen if a public plan exists, the health care insurance industry, as we know it, will cease to exist because government will always price its product less.
Dr. Price, do you want to talk about that as well, how we option, the so-called public option, leads to government-run health care?
I think the important point about the bureaucrats being involved in terms of the public option is that it makes the referee and the player the same person. And if the referee and the player is the same person, the other team always loses. So having a public option means that, in fact, bureaucrats will be making healthcare decisions. Another issue that inserts bureaucrats into the fray, into the situation, is any mandate, either individual or employer mandate. Because what that would mean is that Congress would then be defining what health insurance is, what qualifies as health insurance. And if the government's defining what qualifies as health insurance, then that means that bureaucrats are deciding what individuals are able to receive in their health insurance package.
But when you talk about bureaucrats making decisions for patients, are you also talking about insurance company bureaucrats? Because everybody, I think, has had an experience with insurance company bureaucrats making decisions.
I think one of the things we're talking about particularly is a system where, as Jenny said, if you like what you have, you can keep it, but even you should have more choices. We think the marketplace works better than the government, and more choices is helpful. If you don't like your insurance company, you really should be able to choose another one. You know, one of the reasons that Medicare Part D has the high level of satisfaction that it has is every single person in that plan knows that sometime in the next 12 months they can change their provider, and their provider knows that as well. So in addition to our principle that if you like what you have, you can keep it, it's a very important addition to that, but you also want to have options to go outside that system with tax benefits and other things that allow you to go outside the system.
Are you talking about employer-provided, people who are in employer-provided?
Most people are in employer-provided. Most people either employer-provided coverage or government-provided coverage under Medicare and Medicaid. That's where most everybody is. Dr. Castani, do you want to talk about
Let me just add something. As a physician who's dealt with insurance companies and patients on a regular basis for 20 years, yes, insurance companies do tend to make bureaucratic decisions, but there's a well-defined appeals process to deal with individual cases. It's unwieldy at times, and it could be improved, but it does exist. There is that appeals process. However, with Medicaid, or Medicare, I should say, that appeals process is very, very difficult, if non-existent, and that's the difference. And that's why we don't want to go down that route with the government. One of the reasons we don't want to go down the route with the government-run plan.
Okay, this is a very important topic of obviously our discussion. So we're going to have 3 more people who want to say something about that, and then I think we're going to have to go to the floor to vote here. Then Mr. Shattuck, and then Dr. Gingrich and Dr. Murphy.
I just want to answer your direct question. Yes, we believe people that are in an employer plan should have the choice of keeping their employer plan or choosing to go somewhere else. We believe that kind of choice will force a reduction in cost, an increase in quality, and will give people control over their own health care. We give people choice in buying all other kinds of insurance in America today. We think we can give them that kind of choice in health insurance as well, and that will drive the kinds of reforms we need. We genuinely believe in choice and want to really effectuate it. If you like your employer plan, fine, keep it. If you don't like your employer plan, then we're going to enable you to get another plan. We're going to increase cooling mechanisms and other devices so that, in fact, if an insurance company bureaucrat, if you feel improperly turns down your claim, or the insurance plan simply doesn't treat you well or doesn't have the doctors you want, you can make a choice and go elsewhere. We believe that's one of the things that's causing the excess costs in insurance today. People don't have choice. They're trapped in their employer's selected plan.
Okay, Dr. Gingrich?
Well, thank you. I want to go back to the question that the reporter asked about bureaucracy, and then suggested that, well, of course, in the market, the insurance companies have bureaucracy. Of course, they do. But we're talking about the difference in big B and little b. Little b bureaucracy for the private market, big B, big brother bureaucracy for the federal government, and that's what we do not do.
Okay, Dr. Murphy.
Along those lines, some of the things that we recognize is people need to have the flexibility of choosing their doctor, choosing their plan. One of the problems that has burdened us with Medicare and Medicaid is it is a massive bureaucracy to try and change. If you wanted to have a doctor do more primary care work, it's going to take an act of Congress. We want them to do prevention, they're not paid for. We want them to do disease management, you can't get that under Medicare and Medicaid. We believe this system can be made more effective and efficient by providing these choices for doctors, patients, and plans, and to focus on the doctor-patient relationship And that's a fundamental difference we have with any government-run plan.
And within the government-run plan, the only lever you have to pull to control costs is to ratchet down reimbursement to providers. We pull it every 6 to 12 months, and it's unacceptable.
Now, the one thing you see about the answer to this question is how active this group has been in all of our meetings. You bring a topic, there's lots of information. We think we want our members to all get as engaged in this discussion as they need to be. That's one of the goals of our sessions today, and Mr. Camp's going to have the last
I
word.
just want to say that Part D, we just had some information released yesterday on that. That really shows us the model where Part D is now 40% less in terms of projected cost than expected. If the majority had their way, the average premium for Part D would be $42 a month. Now the average premium is actually $28 a month. So this idea of having choice for individuals actually does help bring down costs because, as Mr. Blood said, they know that in a year they might choose another plan.
And some of them know in a month. You know, everybody on Medicare Part D knows that sometime in the next 12 months they have that option. And you know, Mr. Shaddick's point, we both tried to make it, and we tried to make it because it's very important. Even more options for people in the current system, we believe, makes the current system work better. You know, the current system runs as if it was a free market system, but really it's largely a captive system. And everybody will benefit if there are more choices in that system. Most of the people that have health insurance today have the choice: do you take the health insurance your employer provides or not? We think everybody, including the employer, benefits if you expand that into the marketplace that Dave Camp just talked about. So, thank you all.
Thank you.
Now, we need to get a strategy before